So for the crutch fitting, you're going to first ask your patient to stand tall and have their feet shoulder width apart. Then you're going to measure one of the crutches first, having it 2 inches away from the foot and about 6 inches in front of, and then you're going to lean it in. You want to make sure that there are about 3 finger lengths or an inch between the axilla of the shoulder and the top of the crutch. And then you also want to make sure that her elbow is at about a 30-degree angle. So right now, if I measure the axilla, it's a little bit high, but if I have her put her arm down, I would say it's still 3, so I wouldn't change it. So now I want to make sure that the hand rest is in the correct spot. So it should be at about the wrist crease. So right now it isn't, so I'm going to take the crutch and I'm going to undo the butterfly screw and take off the washer. And then I'm going to push the screw and I'm going to adjust it up so that there will be it'll be at her wrist crease. And she'll have more control over the crutch. So now that it's back, I'll measure again. And now it's above the crease, so when she puts her hand on the hand rest, she has a good angle so that she's stable. And now that I've measured both the footrest and the hand rest, I'll get the second crutch and ensure that this has the same measurements and make sure that it fits on her other side. And then
okay, so for walking with crutches, you're going to want to have your crutches positioned 2 feet or 2 inches to the side, 6 inches out in front of you. And then when you take your first step, you're going to go about 12 inches out, and then you're going to just kind of like walk through, and you're going to keep kind of going like that, making sure that you want to have that 2 inches out front, and you're going about 12 inches in front of you. Alright, so now we're going to be doing 25% weight bearing with the crutches. So basically what you're going to want to do is you're going to want to move your injured foot with your crutches. So you're going to have the same position that you had like with the non-weight bearing, but instead of bringing your leg up, when you come down with your crutches, you're going to go heel to toe with your injured foot, putting just a little bit of pressure on your foot. Yeah, so heel to toe, yep. There you go, just a little bit of pressure, not too much because we don't want to re-injure any of the structures. Okay, so for the 75% weight bearing, we're going to go ahead and take away the crutch on the injured side. And so you're pretty much going to be doing the same thing, but just with one crutch this time. And so basically you're going to just put not all of your weight, but a decent amount of your weight now on your injured foot. And your crutch is going to go with your injured foot. And put most of your weight onto that foot, and then just swing through with your other foot.
teaching our patients how to use their crutches on the stairs, we're gonna tell them to put both crutches on the uninjured side. So if you could do that for me. And then you're gonna put one hand on the railing and make sure that you're as close to the stairs as you could to give you enough space to step on. And you're gonna step on first with your uninjured foot and then follow up with your crutch. And then we're gonna repeat that same process up with your uninjured foot and up with the crutch, and you're gonna keep following through. This is just to prevent the patients from falling backwards if they do lose their balance. And then when we're coming back down, we're gonna do the same thing. Make sure your hand is on the railing and the crutches are on both sides on the uninjured side. And as she's coming down, we're gonna do the opposite and start with the crutch down, and then follow up with your uninjured foot and repeat the process. Okay. And then, case where there is no railing, we're going to start similarly with the previous scenario, but with crutches on both sides, and she's going to start with her uninjured leg stepping onto the step, and then following up with both crutches, and do the same thing. So follow up with the step and bring both crutches. This is just to ensure there's stability to both sides. And then as she's coming down, she's going to start with her crutches, so both crutches down to the first step, and then follow up with your uninjured leg and do the same thing.